Black Maternal Health Week is here. From April 11th to 17th, join the Black Mamas Matter Alliance and our partners globally for a week of events and activities to build awareness, activism, and community around improving maternal health outcomes for Black women and birthing people. Launched in 2018 by BMMA, Black Maternal Health Week was created to deepen conversations on Black maternal health, amplify community-driven policy, research, and care solutions, and center the voices of Black mamas and families. This year's theme, Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy, celebrates the power of Black-led organizations to lead systemic change and promote community healing. We acknowledge the legacies of injustice while uplifting solutions rooted in unity, advocacy, and transformative care. From in-person events like the 2025 Black Maternal Health Walk and Block Party to virtual conversations and activities, BMHW25 centers Pan-African, Black feminist, and womanist wellness approaches, amplifies community-led solutions, and calls for collective action. So check out what we have in store for you this year. We look forward to seeing you. Follow BMMA across all social media and join the national conversation using hashtag BMHW25. See you there.
Welcome everyone. Hi, good afternoon. My name is Angela Ina. I'm the co-founder and executive director of the Black Mamas Matter Alliance, or you can simply call us BMMA. BMMA is a network of Black-led, Black women-led organizations and multidisciplinary professionals whose work is deeply rooted in reproductive justice, birth justice, and the human rights framework to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. BMMA is the premier Black maternal health professional organization focusing on building the skills, convening, and mobilizing the global Black perinatal, maternal, and reproductive health care workforce. And we do this to end maternal mortality. I'm so excited to officially open our virtual pep rally to kick off our 2025 Black Maternal Health Week campaign. So thank you for joining us today, whether you're tuning in from your home office, from your community space, wherever you are, we're so grateful to be in community with you. Each year, Black Maternal Health Week is our opportunity to pause, reflect, mobilize, and celebrate the power, resilience, and brilliance of Black mamas and birthing people everywhere. This year, we launch our campaign, and we do so under the theme Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy. And that theme is more than just words. It's a movement. It's a call to honor the past, to engage deeply in the present, and to build a liberated future. We are honoring the legacies of our ancestors and our elders, those who demanded justice, dignity, and care. We are lifting up the leadership of Black-led maternal health organizations, our doulas, our midwives, our researchers, our advocates, our doctors, right? And we are especially calling on Pan-African, Black feminist public health professionals and providers to reclaim our work that is deeply rooted in evidence, culture, and science. In this moment, when truth is under attack and health equity is politicized, to provide care, to lead with compassion, to center the well-being, not only of Black families, but of everyone, is nothing short of a revolutionary act of love. Optimal health and well-being is a human right. And by showing up, advocating, and healing in this political climate, we are not only protecting our people, we are protecting the very future of public health and even of our environment, right? Today's pep rally is about energy, unity, and activation. Whether you're a birth worker, policymaker, advocate, caregiver, or simply someone who believes in this work, you are in the right place. So let's lean in to the power of this moment. Let's get energized, get inspired, and get ready to make this year's Black Maternal Health Week the most impactful one yet. And let me tell you all, I am so deeply grateful and honored to be joined by so many partners in the Alliance on today's pep rally and throughout this entire Black Maternal Health Week. We got a lot in store for you all because this is truly Black maternal health in your neighborhood, not only in here in the US, but also globally. Best believe Black maternal health, birth justice, reproductive justice, Pan-Africanist movement is happening all across the Black diaspora. And we're utilizing this day, this International Day for Maternal Health and Rights to get connected. So thank you for being here. Thank you for showing up for our mamas, our families, and our futures. Let's rally together, y'all. I also want to give a special shout out to our sponsors. Thank you to our Changemaker sponsors, California Healthcare Foundation, and to the Merck for Mothers. Before we get started, we would like to cover some logistical items. For your awareness, this virtual rally is being recorded and live streamed on BMMA's YouTube channel. Everyone is currently muted. Along with this event, we invite you to engage in social media conversations on Black Maternal Health Week all throughout this week of April 11th through 17th. And please be sure to use that hashtag BMHW25. And also, if you want to learn more about how you can get engaged or just understand more about Black Maternal Health Week and even what's happening in your local neighborhood and what our partners are doing throughout this week, please visit our website at blkmaternalhealthweek.com to find events that's happening across the nation. Let's get this rally started. And once again, happy Black Maternal Health Week. First up, we have Isabel Morgan from the Black Women's Health Imperative.
Amazing. Thank you so much. Good morning. Greetings, everyone. Happy Black Maternal Health Week. We're very honored and excited to be here. So my name is Isabel Morgan. I'm the Senior Advisor of Maternal Health at the Black Women's Health Imperative, or BWHI. Founded in 1983 by the amazing Billy Avery, our mission at BWHI is to solve the most critical health issues that Black women and girls face, and certainly maternal health is an issue area that is important to us. You've heard about BMMA's and For Cure for Moms Black Maternal Health Walk and Block Party that's taking place in Atlanta tomorrow. BWHI will be there. We're very excited to participate and distribute pregnancy and postpartum resources, including blood pressure monitoring cuffs. We know from maternal mortality review committees that cardiovascular conditions and hypertensive disorders are among the leading causes of maternal deaths for Black moms and Black birthing people, and we know these deaths are preventable. We're continuing with our programming on Tuesday, April 15th, with critical discussions elevating infertility and fertility preservation as critical reproductive justice issues and that impact maternal health equity. On Wednesday, April 16th, we're going to have another critical conversation on IG Live about the intersection of HIV and pregnancy and resources available to support Black, pregnant, and postpartum people move through their experiences with HIV. And then lastly, on Thursday, April 17th, that's our policy focus day. We're going to be presenting out on our maternal health policy priorities with the Mind the Gap Coalition. We'll also be participating in the Maternal and Child Health Summit with the Foundation of Black Women for Wellness, which you'll hear more about from Michaela. If you are interested in participating, please visit our website at bwhi.org/events. Also, our social media channels, Facebook, Instagram, and LinkedIn. This is going to be a powerful Black Maternal Health Week. Soak it all in, y'all. Thank you.
Hi, everyone. I'm Tony Junius, the communications manager at Mama Toto Village. And so Mama Toto Village is a Black maternal health nonprofit based in the heart of Wards 7 and 8 in Washington, D.C. We offer safe, compassionate, and inclusive support during pregnancy, childbirth, and postpartum. We meet you wherever you are on your journey, whether that's your reproductive, parenting, or professional journey. And so we offer a variety of services, programs, classes, and training that's a part of our collective care model. And so we have wraparound care through our Mothers Rising home visiting program. Our team offers culturally congruent home visiting services from expectant to new parents and during pregnancy and postpartum. And so families receive a variety of services that can include community birth worker or doula care, lactation support, wellness and nutrition support, and it's all a variety depending on each family's needs. We also have expert-led childbirth education and parenting preparation classes that equip expectant and new parents with the knowledge and community that they need. And we also launched DC's first reproductive health pantry that's right in front of our office here in DC. And so community members can come and get free menstrual kits that include pads, tampons, and soon will include reusable period products. And we'll also have safe sex kits that include condoms and lubricants. So the community can come and enhance their access to these vital reproductive health items. And we also have our workforce development department that creates career pathways in maternal health. So we have specialized trainings, whether that's community birth worker, which is our doula pathway, lactation specialist, or perinatal community health workers. And all of these trainings are to help cultivate community-centered perinatal professionals that we have in our community. And lastly, we advocate for systemic change by amplifying voices of Black women and mothers, so things like this, Black Maternal Health Week, to advocate and to engage the community. So for all the different services and programs we have, you can learn more at mamatotovillage.org. And we're looking forward to seeing you all in the community.
Happy Black Maternal Health Week, everyone. My name is Jasmine Gatrell, coming in this day from RJ Squared LLC, based out of Greensboro, North Carolina. RJ Squared LLC was founded in 2020, right at the kind of impetus of COVID there. We want to make sure that we are improving conditions of people of reproductive age. We co-construct joy-filled communities where Black, Indigenous, persons of color residents can participate in abundant living experiences and achieve their desired lifestyle. Our services include technical assistance consultation, training development, and capacity building. We also offer strategic facilitation and planning and conference workshop and skills building. What are we doing this Black Maternal Health Week 2025? Well, what we're doing is we are launching our quarterly newsletter. We are also on Wednesday, April 16th, doing an in-person critical foundations of RJ101 teaching with one of our local health departments. We know in this climate, in this situation, we've got to make sure that we are infusing, engaging, and uplifting people on the local level and continue to do the work that we do across our areas of consultation research. We are imbuing within our research critical foundations with our groups that we work with, the critical foundations of RJ101, important components like reproductive larceny. That is a coined term we've offered up on our timeline, which you can find on our website at rjsquared.org/reproductive timeline. You could also follow us on all socials. We are engaging with Instagram and LinkedIn at RJ Squared LLC everywhere. That's it from us. You all have a wonderful, safe, protective, and healthy Black Maternal Health Week 2025.
Good afternoon. I am thrilled to be joining you to kick off Black Maternal Health Week. I'm Dr. Ayana Robinson, Director of Research and Evaluation at the Black Mamas Matter Alliance. Within the Research and Evaluation Department, our goal is to build the evidence base to advance Black maternal health, and we do this through utilizing BMMA's holistic care and research principles. These principles prioritize centering Black women's voices and experiences, recognizing their rights, and understanding the historical and social context in which they live. They also emphasize ethical research practices, community engagement, and the importance of social justice and health equity in research. The Black Mamas Matter Alliance has been and continues to be committed to citing and championing evidence-based research and data sources in our work advancing Black maternal health. In light of research developments, we find it crucial to reaffirm this commitment and emphasize the fundamental importance of rigorous, peer-reviewed research in shaping public health policy and clinical practice, as well as in strengthening and expanding the Black perinatal and maternal workforce. With that, we hope that you will join our research webinar on Monday, April 14th, titled Healing Legacies, Using Data to Improve Black Maternal Health Outcomes. Happy Black Maternal Health Week, everyone.
Hi, everybody, and happy Black Maternal Health Week. I'm Congresswoman Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. As a co-founder and co-chair of the Black Maternal Health Caucus, I am delighted to be joining the Black Mamas Matter Alliance for today's kickoff rally. I'd like to begin by thanking the entire Black Mamas Matter Alliance team for their visionary leadership to establish Black Maternal Health Week and for everything you do on behalf of Black mamas across the United States. Since Congresswoman Adams and I launched the caucus in 2019, we have been dedicated to shining a light on the critical work led by Black Mamas Matter Alliance. I have been so proud to work with the Black Mamas Matter Alliance to develop, introduce, and advance the Black Maternal Health Momnibus Act, a sweeping package that builds on existing legislation to comprehensively address every driver of maternal morbidity, mortality, and disparities in our country. Thanks to your partnership, we've seen tremendous progress on moving this legislation forward, including the first bill in the Momnibus getting signed into law and securing over $200 million. Let me repeat that. Over $200 million in federal funding for Momnibus priorities signed into law. This funding has stood up maternal centers of excellence, directly supported community-based organizations providing maternal health services in high-need communities, funded midwifery education and training, and so much more. And although this funding is already flowing into communities and improving maternal health care across the country, now more than ever, we must continue to fight for this funding and get the Momnibus signed into law immediately. As Donald Trump, Elon Musk, and RFK slash critical and life-saving public health programs that support mothers and families, we cannot back down. From constituents contacting their representative and senators about co-sponsoring, to organizations including the Momnibus in their advocacy campaigns, to private sector companies engaging in this mission to build bipartisan support, we all have an opportunity to do our part to save moms' lives and end this crisis. I am so thankful to all of you on this call, and as always, to the Black Mamas Matter Alliance for your partnership on these shared priorities. I can't wait to see you again in person soon, but until then, I wish you all the best for Black Maternal Health Week and all the important work ahead of us in 2025 and beyond. Take good care of yourselves.
Hello, everyone. Good afternoon. We are in 2025 Black Maternal and Child Health Week, and we are here for it. Right now, at this moment, we are standing on generations of strength. And here at the Foundation for Black Women's Wellness, and located in Madison, Wisconsin, we are carrying that legacy forward with power. I want to show off my t-shirt. Founded in 2012 by our visionary leader, Lisa M. Payton, after the untimely death of her mother, the foundation was born out of a deep commitment to transform the health and lives of Black women and girls. What began as a small gathering has blossomed into a movement that energizes, mobilizes, and supports Black women through education, advocacy, and powerful partnerships. We're not just talking about change, we're doing the work. We're supporting and training doulas, we're advancing policy, we're centering Black mothers and birthing people. We're uplifting Black babies, and we're building community-driven solutions that last. Our initiatives like Saving Our Babies and Reaching for Wellness are making tangible impacts here in Wisconsin, and even more importantly in Dane County, reducing low birth weights, improving maternal health, mental health outcomes, and ensuring that Black families in Dane County have the support that they need to thrive. And you already know, as I already mentioned, we're bringing that same energy to our 5th annual virtual Black Maternal and Child Health Summit on Thursday, April 17th from 9 a.m. to 1:30 p.m. And our theme this year is joining forces and building alliances to protect our lives and legacy, because this is more about healthcare. It's about liberation, and it's about protecting our community. And we're beyond honored to welcome our keynote speaker, the incredible Dr. Veronica Gillespie Bell. She is a force for reproductive justice and equity, and we cannot wait to hear the nuggets that she gives us. We also want to highlight our groundbreaking achievement that happened this year. We are proud to be the first organization in the state of Wisconsin to secure commercial insurance reimbursement for doula services through our partnership with Quartz Insurance. This collaboration ensures that more families have access to culturally responsive full spectrum doula care, and led by a Black organization. We're ensuring that we're setting the standard for maternal health support. So whether you're showing up in the clinic, the Capitol, the community, or all three, you are part of this movement. Every step we take together makes the path safer, stronger, and more sacred for those who come up after us. Let's protect our legacy, let's build these alliances, and let's rise up together. And I want to thank BMMA for allowing this opportunity, and thank you, Angela. Have a wonderful Black Maternal and Child Health Week.
Good morning or good afternoon, everyone. My name is Dr. Nastasia Harris. I am the founder and executive director of the Perinatal Health Equity Initiative. Happy Black Maternal Health Week. We are a nonprofit organization based in East Orange, New Jersey, focused on eliminating inequities in Black infant and maternal health. We do that through our 4 Ps, which are pregnancy, preconception, postpartum, policy, and research. Some of our signature programs include Mamas in Bloom, which is a wraparound support program that combines nursing care with a community support worker. We also have our Cuff It program, which is designed to support women that have high risk for preeclampsia disease. So we provide them with a blood pressure cuff and provide them additional clinical guidance through their journey with preeclampsia, both during, before, and after delivery. We also have a suite of breastfeeding support programs, which includes our clinical lactation care, as well as our support group, Sisters Who Breastfeed, which meets in person and virtual. For Black Maternal Health Week this year, we have 2 events. The first is on April 14th, which is called Can We Talk? Art as Liberation in Black Maternal Health, and we are honored to have artist Lauren J. Turner speaking with us during that event, and we will be doing some giveaways. So if you loved Lauren's art and are interested in getting a piece, be sure to register for that event. And our final event will be on April 16th. As Isabella mentioned, preeclampsia and hypertensive disorders, cardiovascular disease is the leading cause of death for Black women, and we are leaning into that as an organization. Our second presentation is Unpacking Preeclampsia and Protecting Black Maternal Health, which is on April 16th. I am also very excited to announce that we will be launching our Preeclampsia Bootcamp, which is designed for people who are working with Black birthing individuals who are at risk or have preeclampsia. So that will be launching in May as a full training. And I am also excited to announce in June, we are opening the Lieutenant Dickey Black Maternal Health Center, which will be the first of its kind in New Jersey, designed to provide clinical care during pregnancy and postpartum specifically for Black women. So you can learn more about our services on our website, www.perinatalequity.org, or on our Instagram, which is under the same name, Perinatal Equity. Thank you, and I hope you all have a wonderful Black Maternal Health Week.
Hello, everyone. I'm Tamika Jackson. I am the Reproductive Justice and Black Maternal Health Organizer with Mothering Justice based in Michigan. I am so honored to kick off Black Maternal Health Week with all of you. At Mothering Justice, we believe that when Black women and Black mamas lead, policy gets better for everyone. And that's not just a tagline, it's how we really feel. This week, I'm hosting events across the state under the theme Our Bodies, Our Births, Our Babies. From our libation ceremony this evening to kick off the week, to pay honor to those that are no longer with us, to our storytelling open mic event that I'm hosting at a local coffee house, to our resource fair this Sunday that's going to be partnered with Planned Parenthood to provide our moms with the resources that we have currently. And then, of course, the webinar that I'm partnering with Black Mamas Matter Alliance coming this Thursday. We also have digital storytelling that's going to be happening on social media, and we're creating spaces not just to raise awareness, but to build lasting power. We've trained and mobilized over 100 Mamavists. They're our grassroots leaders to testify, to organize, to push for legislation like our Michigan Momnibus and our paid sick time legislation, because we know that economic justice is reproductive justice. And if you're in Michigan, you can join us for our lobby day, our Mama's March on April 30th. And if you're anywhere else, follow us on Mothering Justice, at Mothering Justice on any social media platform. And if you're interested in coming to our events in Michigan, go to motheringjustice.com/events. Please share your story, sign up for our action alerts, and most important, your voice is the evidence. Thank you all for being a part of the movement. Let's keep showing up loudly, unapologetically, and for our Black mamas. And thank you guys so much.
Greetings, everyone. My name is Milan Spencer, and I am the Associate Director of Workforce Development and Partnerships here at BMMA. The Workforce Development Department serves as the central educational hub within the Black Mamas Matter Alliance, dedicated to providing continuing education, training, technical assistance, and sharing essential knowledge and competencies in Black maternal health with the purpose of strengthening the global Black perinatal, maternal, and reproductive healthcare workforce. Some examples of these offerings include our 9-week Black Maternal Health Incubator Hub pilot learning cohort, our Training Institute Day at the Black Maternal Health Conference, where we offer full-day in-person skill building, and web-based learnings like our Perinatal Workforce Enrichment Series hosted last fall. Our work is deeply important to the advancement of Black maternal health. Black perinatal providers that are trained in our grounding frameworks are uniquely equipped to provide care that results in improved outcomes among Black women and birthing people. We will continue our efforts to provide such learnings and opportunities through collective action and continued collaboration with our alliance partners and external stakeholders. So as we kick off this Black Maternal Health Week, I want to encourage those of you who are in the movement to continue to engage with us this week and beyond. Those who are local to Atlanta, Georgia area, please grab a ticket and join us at Tuesday's professional networking event taking place in the evening from 6:30 to 8:30 at the Lola. Go to blkmaternalhealthweek.com, blackmaternalhealthweek.com, and click on events for more information. And then join us on Wednesday on BMMA's YouTube channel at 1 p.m. Eastern for a live conversation hosted by myself and Dr. Ayana Robinson, discussing lactation justice and community milk sharing with our guest, Jasmine Williams from Blackberry. Thank you.
Greetings, Black maternal health champions. It's an honor to share this space with you. Happy Black Maternal Health Week and Black Doula Day. Thank you, Angela Ina and the BMMA team, for providing us a cultural, political, and spiritual home for us to be strengthened in doing this work. My name is Jamara Amani, and I am a mother of four, a midwife, and the executive director of Southern Birth Justice Network. We are the creators of the Birth Justice Framework and the Birth Justice Bill of Rights, and have been on a mission to build the movement for birth justice since 2009. I love this year's theme of healing legacies because we know, as champions, that health disparities are not isolated issues. They reflect the power imbalances in our society that must be addressed in order to achieve total well-being. As a proud Black midwife, I believe it's time to reclaim our power and restore our legacy. It is vital to understand that the targeting of midwives and the criminalizing of birthing people has played a key role in reproductive oppression and in the abysmal maternal health outcomes that are disproportionately impacting our people. Healing this legacy is essential for achieving reproductive liberation and ensuring birth justice. So with that being said, I'm excited to tell y'all about what we're doing this week at Southern Birth Justice Network as we engage in events, a series of events centered on education and advocacy and building power for Black birthing people. So we will be today, in celebration in honor of Black Doula Day, we will be having our Black Doula Day packing party and mixer here in Miami, Florida. So if you are in South Florida, please join us. We will be eating some good food together. We will be packing postpartum packs for folks in our area and around our state that need that support. And most importantly, we will be building community and joining together in the spirit of love, in the spirit of liberation. And then tomorrow, we will be having our community wellness walk with Girl Trek. Woo woo, shout out to Girl Trek at Virginia Key Beach, which is a historically Black beach here in Miami. When they wouldn't let Black folks go to no other beach, we had Virginia Key Beach here in South Florida. So we will be meeting there at 8 a.m. tomorrow for the community wellness walk, where we will have ceremony. We will be honoring our ancestors. We will be walking together. We will be dancing together. And we will be reclaiming our legacy of wellness as a community. Our mobile midwife clinic will be there for anyone who needs access to midwife and doula care. We are a donation-based clinic. We provide free access to midwife and doula care for anyone in our community who needs it. So meet us out tomorrow at the beach. On Monday, April 14th, we will be getting on the bus. So we will be taking our concerns, our voices, and our power to the state capitol in Tallahassee. We will be making the journey from Miami, Florida, which if y'all don't know, it's a bit of a journey. So it's about a 7-hour drive for us. We will be picking up folks in Orlando, and we will be heading up to the Capitol in Tallahassee. We have an agenda there for 3 days. We will fellowship. We will get a lobby training. We will have our advocacy day where we will meet with legislators. We'll have a press conference on April 15th, and we will have our healing circle. After all that, taking over the people's house, we have to come together and recenter and decompress and reground and remember our spirit of resilience to continue building this movement and this work. So we will be in Tallahassee from April 14th to the 16th. And then on April 17th, we will participate with the Black Maternal Health Summit that was just spoken about earlier in the call. So really excited to be a part of that virtually. On April 18th, we will be part of the Florida Reproductive and Maternal Health Virtual Summit, speaking about the power of midwifery and reclaiming our reproductive health. On April 19th, we will participate in the Fertility Expo. That will be at the Urban League in Broward County, again, here in South Florida from 10 a.m. to 5 p.m. And again, we'll feature our mobile midwife clinic. So if you want to come out and see our midwives, shout out to midwife Sheila, midwife Tanya, these incredible Black midwives that have been serving our community for decades. Please come and meet them and get access to care that you may need The expo itself is going to be amazing. If you want more information about any of these events, I was literally reading them off our Instagram. Please go to @SouthernBirthJustice on Instagram, where all of the links are in our link tree, in our bio, and you can sign up and register to be a part of it. Happy Black Maternal Health Week, and looking forward to continuing to build the movement for birth justice with all of you. Thank you.
Greetings, everyone. Happy Black Maternal Health Week. My name is Shanti Moore, and I am a doula and a midwife and the Birth Justice Training and Curriculum Coordinator with Sister Song. Sister Song is a national women of color-led reproductive justice organization that works to improve institutional policies and systems that impact the reproductive lives of marginalized communities. And through our Birth Justice Care Fund, which I'm so proud to say is in its 5th year of operation, we provide doula support services, mental health services, lactation support, as well as essential birthing items to families in Georgia, Florida, North Carolina, and Kentucky. We also host a quarterly labor support training for birthing people and families without access to doula support. Coming up this summer, we will be in our 2nd year of our We Outside series, which focuses on perinatal nutrition and exercise. And we will also be hosting another Black maternal mental health resource fair this year, as well as having our first Black Infertility Awareness Week convening. We did do a kickoff to the kickoff for Black Maternal Health Week yesterday, where myself and my colleague Chanel Stryker hosted an IG Live with doulas and midwives in the community talking about the importance of Black birth workers to Black maternal health. And we will also be providing information throughout the week via our social media sites. So please check in and check out what we have there. And again, happy Black Maternal Health Week.
It's me. Hello, everybody. Thank you so much for giving us the opportunity to present to you all today. We are live from Philadelphia in our Black Maternal Health Week birth worker brunch. Here with everybody, say hi. Yes, thank you so much for giving us the opportunity. My name is Salima McNeil. I'm the founder and executive director of Oshun Family Center here in Philadelphia, and we are kicking off Black Doula Day and Black Maternal Health Week with our birth worker brunch. So thank you so much for giving us the opportunity to come on to talk about the events that we have here in Philadelphia for Black Maternal Health Week. So today is our brunch. Tomorrow we will have our community-based baby shower at Temple University, and then we have a wellness event on Sunday. On Monday, we rest. We have a virtual day for advocacy. By Tuesday, we go out to City Hall to talk to our council people to understand Black maternal morbidity and mortality from the perspective of us as birth workers and the voices of the people in the room that matter. And then lastly, we have a art exhibit that is in collaboration with Creative Mind Productions, which is our fatherhood initiative. Fathers Actively Dedicated Every Day, which will be an exhibit at Community College of Philadelphia. And then we end the week with our mixer because we bought a building, y'all. So we will be the first Black-run, women-led, community-driven maternal wellness center here in Philadelphia that enhances the standard of care. So thank you all so much for giving us this opportunity to come on and fellowship with you all. But we got a show to get started. So we're going to head out, and we love you all. And thank you so much. Say bye. Thank you all so much.
Good morning, good afternoon, wherever you are. It is my hope that you all are super amped. I mean, because Salima brought it to us. I hope that you all are getting super excited about what's ahead. I am Kay Matthews, Executive Director and founder of the Shades of Blue Project. Might I add, a mighty proud Alliance member and board member to boot. As the Executive Director and founder of the Shades of Blue Project, we are a national organization on a mission to address systemic gaps in maternal mental health care, especially for Black mothers and birthing people who continue to be overlooked, undersupported, and unheard. At the Shades of Blue Project, we provide a full range of services: free mental health therapy and culturally aligned support groups, birth and bereavement services, free diapers, wipes. We have our Inspire Method certification, where we show you what is working best in the community, how to serve those who we want to see get over whatever that thing is. What I have learned in doing mental health, this is individualized care. And that is the goal through our Inspire Method training, is to show you how to give individualized care, because there is no one size fits all approach to any of this. As we amplify Black Maternal Health Week, join us today, 3 p.m. Eastern, as we talk to the brothers. We are bringing the men into the fold and having them to join us in a conversation about, one, sharing their truths, talking about generational curses and the silence that come along with it, and centering themselves in the conversation around Black maternal health and how we move forward together in tandem. And then July, we got next, y'all. We are gearing up for Black Maternal Mental Health Week. We're going to be amplifying stories, shifting the system, celebrating our strengths. If we have never tapped into our strengths before in this current climate, that is what we are all doing. Which is why I cannot say enough how I am sending each and every one of us who continue to show up lots of love, lots of renewed energy, in a time where it feels like that is non-existent. As Black people, we are joy. And so I want to remind us to continue to seek just that. In doing this work, we must show up for ourselves so we can show up for others. The gist of it is none of us can do this alone. And so we all need each other. Let's keep that in mind. We all need each other. And ways that we can continue to do this is to, one, show up for ourselves, show up for others, sharing our work, supporting the services that we are all out here offering, showing up for our community, whether you are a policymaker, a partner, a provider. We're all involved in this. We're all in this together. And I believe at the end of the day, it is going to take all of us to continue to build this accountable village, acknowledge our traumas, respect our journeys, and provide real sustainable support for everyone, so that we get those outcomes that I know that we are all certainly out here striving to get to. So as a closer, continue. Let's all make shift happen together. Happy Black Maternal Health Week, y'all.
Thank you so much for this invitation. My name is Lakeisha Camise. I am with Black Women for Wellness and Black Women for Wellness Action Project. We have a C3 and a C4, and just wanted to uplift what we're all about. Black Women for Wellness has been committed to the health and well-being of Black women and girls. We do this through health education, empowerment, and advocacy. And since we have a little bit more power on our C4 side, which was, I would be remiss if I didn't say that Black Women for Wellness was birthed about 35 years ago. And we saw the need where we needed to have birthing mothers paired up with some of our more seasoned folks in the reproductive space, and just let them walk through that birth journey together and have that support system up until a year postpartum. As far as our action project side, we realized that systemic racism and sexism have very deep roots. And it shows up in our policies and that influence our health. And that's what our action project is part of. We're going to challenge those systems of oppression. We want to shift that power dynamic, and we do it through a multiple of ways. We endorse our own candidates, and I mean not just at the federal level, at our state level. We do it all the way down to our superior court judges because we do realize that we have an issue with overcriminalization of our birthing people and our Black community as a whole. We also harness our political power through lobbying efforts, through legislation. We are currently carrying a robust legislative package. And if you know nothing else about Black Women for Wellness, just know that we get policies pushed in place. We get policies passed. It's evident from AB 65 that passed in 2021. That is called our Momnibus Act. And so we realized with that act, we got together with a bunch of our coalition partners and realized that our Black mothers and babies, have far higher death rates than other races, and that a lot of it has to deal with the implicit bias that is within our healthcare community. So we said, look, we're taking this fight to our legislators. We are there in their face. We are doing those ledge visits. We're getting those letters of support. And we are pushing it out to make sure that Black women and girls not only survive, but that they're healthy and that they thrive. We have so many events. It is unbelievable, and I'm just so excited with all the events that we have for Black Maternal Health Week today at 1 p.m. If you are in the LA area, I highly recommend that you join us. We are launching our Black Joy Guide, and it's a guide for mamas. Where we are just celebrating this birth journey and motherhood and amplifying those voices and just fostering advocacy for equitable care. We are going to be at the Kaiser Permanente Baldwin Hills Crenshaw, shout out to Leimert Park where we are. And we're going to be at their conference center today. Additionally, we also had a Black Maternal Health Symposium in San Joaquin County. It is our third annual. And that is a shout out to our other office in Stockton and our community liaison, Kim Robinson, who has just been holding it down in the Stockton, Sacramento, Central Valley area and making sure that we have a greater presence. And we're just going to be strengthening our Black maternal health through collective action and advocacy. And lastly, it is on April 15th. Yes, most people think it's tax day, but for us, it is going to be our second annual Black Mamas Birthing Tour. And so what we're doing is taking a bus full of birthing mamas to explore different birthing spaces and resources within LA County that honor and just uplift these mothers with culturally affirming and competency care and dignity and joy. We are partnering with a plethora of people. And the locations we're visiting is Providence, Little Company of Mary Torrance, Kaiser Permanente, South Bay, the MLK Junior Community Center, Kindred Spaces, LA. So just giving our birthing mamas those opportunities and resources to just, live in this Black joy and birth these beautiful babies and know that we're here with all this support. So thank you so much for having me.
It is not allowing me to unmute my video. There we are. All right. Good afternoon at this point where I am. Good morning, wherever you may be. Daryl Brown, Director of Programs here at IB Black Girl here in Omaha, Nebraska. IB Black Girl serves as a collective for Black women, femmes, and girls to actualize their full potential, to authentically be through autonomy, abundance, and liberation. We are so excited to be in this space with so many of you doing such amazing work and doing this amazing work on behalf of Black birthing folks. We're so grateful to be in space with you all. We have a number of things that are coming up this week, starting tomorrow. We have our Heart, Soul, and Roll walk run event, which is happening tomorrow from 9 a.m. to 12 p.m. Right here in the heart of North Omaha to enhance overall health and bring awareness to where we stand as relates to maternal and infant health. Additionally, we have on Monday, the 14th, we have Remembering Anarcha, the screening of the movie Remembering Anarcha. That will happen from 5 p.m. to 7 p.m., where we'll be diving into the powerful story and legacy of Anarcha Westcott, an enslaved Black woman whose body and nursing work has provided us priceless gains in maternal and infant health. We also will be having some educational sessions with a national organization, national healthcare organization, to uplift the reason for and the importance of this maternal and infant health work. And we also, in addition to that, will continue to host our education session for our doula passage program, where we are training doulas, certifying doulas here in the state of Nebraska to provide doula services to pregnant women and girls. And then, last but not least, we will definitely have a social media push to provide community awareness around maternal and infant health. So, a lot of great things happening over the course of this week. We are definitely trying to lean into the Healing Legacies theme and create that legacy of well-being for our Black birthing folks. So thank you all for this space and for this time.
I look crazy. Hi. Hi, this is Gwen Moore. How are you? Am I unmuted? Listen, I am so happy to be here with you all today. I'm very concerned about maternal health. I had a call earlier today with my local health department where we're having a crisis in lead paint poisoning in my community. And they have learned that, of course, the funds for mitigating lead and doing the follow-up has been pulled. So we are rightly here to rally around the other things that have an impact on our future workforce. And it starts with good maternal health. Listen, I'm a mother, a grandmother. I'm a great grandmother. I'm a triple G. My great grandkids call me G, and maternal health is personal to me. I have a queendom. I have one daughter and three granddaughters, three great granddaughters. And so I'm anticipating for a really long time beyond my own life that getting maternal health right is important to my family, to my legacy, to my community. So happy to be joined by Lauren Underwood. She's one of the most popular people and most remired and respected members of Congress in the entire state of Illinois. So proud that she's a product of the Congressional Black Caucus Foundation. She was literally our first product, as it were, to go from being sort of an intern to becoming a member of Congress, and not just a member of Congress, but someone who has brought great insight, particularly with regard to maternal health, to our attention. I'm so pleased that Lauren Underwood, as you may already know, has really been the champion and caucus chair of the Momnibus, which literally put together 12, I believe it was, 13 bills, all dealing with maternal health and pushing them as a package. After we lost Kamala Harris to the vice presidency, Senator Cory Booker became our champion on maternal health in the Senate. You know, we really got to fight, y'all, because the Republicans have a narrative, a lie that they don't plan to cut Medicaid, which we know is critical toward maternal health, that they don't plan to do it, that they just want to get the little lazy white boys that are in their basements playing video games out, and that's where they're going to realize the savings in Medicaid. What they're really talking about is obliterating Obamacare and snatching away monies from people who can't afford health insurance, don't get it on their jobs, and have been able to buy insurance through the marketplace. My granddaughter, who is of childbearing age, under 30 years old, is one of those people who took a risk and started her own business, her own home daycare child services, and she's very nervous now that she will not have any health care. And I know that the idea of getting pregnant again, she has one child, is terrifying to her because of the health insurance fear that she has. You know, and this administration is talking about restructuring the program. Not only would they throw off people who are getting funding on the marketplace, but they're talking about block granting Medicaid. And when you block grant Medicaid, just think chopping block. That's all. If you don't know what a block grant is, just think chopping block. And so instead of it being a program that will meet the needs of everyone who's eligible, it will, when it runs out, when the money runs out, it'll just run out. Of course, the hospitals will get their money for births that occur at their hospitals, about 40% under Medicaid. But I mean, there is no guarantee that we're going to have prenatal care for mothers, nor things like doulas, which we know make major interventions, particularly in at-risk pregnancies. I don't know what their plans are to fill in the gap, but when you're cutting $885 billion out of the Medicaid space, we have work to do. So we have prenatal and postpartum to be concerned about. We have found that the risk of, say, suicide, for example, postpartum, are elevated. And so, once Junior pops out, is not the end of the road in terms of our needing to make sure we diminish and decrease this. I know equity is a dirty word in this space, but the reality is that in the richest country in the world, that Black women, brown women are 2, 3 times as likely to experience, uncertain births. So rather than cutting Medicaid, I just want to expand Medicaid to include doulas and midwifery care. And I have a bill, the Perinatal Workforce Act, that's part of the Momnibus that Representative Underwood is the shepherd of, and is aimed at creating a diverse and culturally competent perinatal workforce. And we can't be ashamed of saying that equity is a part of it, because to the extent that our women are dying at a much higher rate, we cannot be Pollyanna about this and allow them to DEI shame us. Also, I've got a birthday coming up. I'm one of the boomers, and to the extent that 10,000 of us are retiring every day. We need more people to be qualified in the healthcare space, and particularly with regard to maternal health. I mean, we need doulas, we need physician assistants, midwives. I've had 2 children born with the help of midwives. And you know, when my Republican colleague Vern Buchanan, who's the vice chair of the Ways and Means Committee, asked me to be a co-sponsor on his bill, Food is Medicine, a pilot program at the Veterans Administration, and I said I would do so on one condition. One condition, and that is in his Food for Medicine pilot, we include maternal health in that project. And so rather than just retreating, as this administration appears intending on doing, I think we need to redouble our efforts, throw more resources at this problem. And as long as I'm around, I'm going to be a partner and a champion with you to help and save lives. And during this week, where we acknowledge the importance of maternal health, let's be mindful that it takes, 40 weeks, and then more weeks, postnatal to care for our population. And so the fight is on. This week, we got to lift up the entire post and pre natal care, because this is our future, not just for our Black and Brown communities, but for the American community, where birth rates, we don't have the adequate birth rate to make sure that we have a sufficient workforce to carry out all of our aspirations. And a good start would be to prevent maternal deaths. So thank you, and I'm going to yield back.
Well, good evening, everyone, and I want to thank Congresswoman Moore for that fine presentation. Thank you. It's always great to see you and to work with you in this space. I am Congresswoman Alma Adams, and I represent the 700,000+ citizens of the 12th Congressional District in North Carolina, which includes Charlotte and Mecklenburg County. So happy Black Maternal Health Week to everyone. Indeed, it is a pleasure to be here. I will be introducing a resolution in Congress honoring this week and uplifting the work that you're doing today. I am the co-founder and co-chair of the Congressional Black Maternal Health Caucus, along with Congresswoman Underwood of Illinois. And while we are different in terms of the gap in age, we come together on this issue. And so the work that we're doing in Congress depends on the work that you do, advocating for our communities. Our caucus's number one priority is passing the Omnibus Act. As you've heard, it's a collection of 13 bills that would comprehensively address the Black maternal health crisis. But in the past few years, we've gotten over $200 million in new funding to go towards addressing this crisis. And this funding has gone towards a number of things: expanding and diversifying the perinatal workforce, including midwives and doulas. And you just heard Congresswoman Moore talk about midwifery, community-based organizations that are serving our moms, research grants at minority-serving institutions on maternal health disparities, a maternal mental health hotline, very important, a mental health hotline, and so much, much more. So you see, we're going to see the benefits of this funding for years to come. It's not really about us who are all here today, but it's about our daughters and granddaughters and great-granddaughters. And Congresswoman Moore, I'm a GGG too. I have one great-granddaughter, 8 months old. But we've got to do more. And I don't need to tell you what's at stake. With the Trump administration's cuts to staff at federal health agencies and the impending cuts to Medicaid, this work has never been more important. Now, just in North Carolina, We just got around to expanding Medicaid. So many people who didn't have health insurance, 400,000 or 500,000, now have an opportunity to see a doctor. That includes women who are about to give birth. And so we're very concerned about the cuts and the proposals that are on the table. Congress needs to hear from you. My colleagues in Congress need to hear that Black mamas do matter. So we need your voice to get the Momnibus passed into law, because guess what? Our mamas can't wait. Thank you so very much for having me today. And listen, I'm sure that we're going to have a lot of success as we move forward.
Hi, everyone. My name is Brittany Dubrow, Root Certified Perinatal Support Specialist and Director of Programs with Restoring Our Own Through Transformation here in Columbus, Ohio. It is an honor to be here today to talk about the work that we do here at Restoring Our Own Through Transformation. I want to give thanks for those who have done the work, paved the way for us, and continue to pave the way for us, and for our families that entrust us and allow us to support them in one of the most sacred times of their lives. Restoring Our Own Through Transformation is a Black women-led reproductive justice organization dedicated to collectively restoring our well-being through self-determination, collaboration, and resources to meet the needs of Black and marginalized families within communities. We specifically focus on the entire family and believe that our families have everything that they need within. We do not view our families at a deficit, instead combat against the oppressive system by providing perinatal support specialist services to families from the thought of conception until the child is 3 years of age. We are an intricate part of the perinatal experience. We meet our families where they are, and we meet them bi-weekly up until they're 6 months old, and then continue to meet with them monthly until the child is 3 years of age. Within providing these services, we acknowledge that the perinatal support specialists, or doulas, are not the saviors for this negligent system. Instead, our role is to focus on restoring the well-being and re-empowering the Black family. Our CEO and founder, Jessica M. Roach, and creator of the Web of Causation, Social Determinants of Health, founded this organization in 2017, rooted in her lived experiences, knowledge, and education. Through her leadership and dedication to addressing Black maternal and infant mortality, Root has successfully maintained a 0% maternal mortality rate, and we've only lost one baby at the age of 4 months. We view our work of our perinatal support specialist as a necessity to the workforce development of Black maternal health. We are a team of social workers, nurses, teachers, public health officials, and more. We believe that when we are doing the work, we not only have to ensure our families' needs are met and taken care of, but the individuals providing the needs are taken care of as well. And that's why here at Root, our employees are salaried employees with benefits. Our organization has been boots on the ground in the community for the past 7 to 8 years. Now our organizational model is expanding to an easy access clinic that will focus on holistic wellness. We'll have a certified nurse practitioner, nephrologist, nutritionist, licensed social worker, and we'll be expanding our division of behavioral health that will not only focus on maternal mental health, but the entire family's mental health. With the opening of the clinic, we will continue to offer our home visiting services and perinatal support services. Black Maternal Health Week is an important week to highlight the work we do. However, the work does not stop after this week. It is on us to continue to mobilize, organize, and support community and local efforts as we address Black maternal health as a collective. If you're here in Columbus, Ohio, and you're looking for events to join us during Black Maternal Health Week, feel free to come out to our family cookout on April 13th from 1 to 4 p.m. at Grind and Ground. That is a Black maternal health cookout celebrating all Root families, current and past Root families. And then April 17th is the last day of Black Maternal Health Week, and that is a very special day for us here at Root. We will have our soft clinic opening of the Root Health and Wellness Clinic. I thank you all for your time, and happy Black Maternal Health Week.
Good afternoon, everyone. I'm so thankful to Black Mamas Matter for having me on here. I'm Dr. Jacqueline Hairston. I am from Northwestern Medicine in Chicago, Illinois, and we are thrilled to be hosting our Black Maternal Health Week, our open house. We are hosting an event for all people in the community. You don't have to be pregnant. You don't have to be even thinking about pregnancy. If you just want to meet us and see what Prentice Women's Hospital is like, we're hosting an event on Tuesday, April 15th from 5 to 7:30. It's an opportunity to meet physicians who look like you, look like us, as well as our midwives, our nurses. The event will include consistent tours throughout the entire time of our postpartum unit, our labor and delivery unit, and our OB triage. On top of that, we will have hot topics being addressed, including what to do if you're struggling with infertility, what does it mean to be of advanced maternal age, and are you high risk? These are important questions that everyone wants to ask, and we're having our physicians, our midwives, and our team there to address it. After our hot topics, we will have a question and answer session where people who register for the event can submit questions beforehand, but we're also going to tackle some of the viral videos that we've seen circulating the internet that can help dispel some myths about pregnancy and the postpartum period. So we hope that everyone is able to join. If you know people in the Chicagoland area, again, they don't need to be patients of Northwestern. We really just want this to be an educational event. We'll have stations where people can learn about epidurals. Our midwives will be talking about pushing positions that we want people to access, even when you have an epidural in place, as well as talking about birth control options, having our pelvic floor physical therapists available, as well as our lactation consultant. So it's going to be a wonderful event. I'll put the link in the chat. It's completely free. The registration just allows for people to get parking for free parking. So if you register in advance, we will make sure your parking is covered and there will be heavy appetizers served. I'm happy to take any questions or message me offline, but we're so thrilled to be working with Black Mamas Matter to promote this during the pep rally. Thank you.
Thank you. Thank you so, so very much to everyone. Thank you to all of our partners in the Alliance, all of our stakeholders that have joined us today on this call. I also want to give a special thank you to our Congresswomen, our representatives, Congresswoman Gwen Moore and Congresswoman Alma Adams. Congresswoman Alma Adams, God bless you. You have been with us from the very start, from the very first Black Maternal Health Week campaign, and was instrumental in helping us introduce the very first Black Maternal Health Week resolution at the federal level in 2018. And so we're so deeply, deeply, deeply in deep gratitude to our champions, our Black maternal health champions at the federal level and at the state levels and even at the local levels. I also want to lift up our home state and our home city of Atlanta, Georgia. Just want to give thanks to the city of Atlanta and to our mayor for shouting out Black Maternal Health Week and for passing a Black Maternal Health Week resolution here in Atlanta, Georgia. So we are really moving and shaking this Black Maternal Health Week. We also want to lift up all of our partners, all of our Black doulas that's celebrating Global Black Doula Day today, April 11th, not only here in this nation, but across the globe. You know, check out our partners. They're doing great work. And also want to lift up that today is International Day for Maternal Health and Rights. You don't want to miss it. We have more conversations happening today. Also, check us out on our Instagram page, Black Mamas Matter Alliance Instagram page today at 4 p.m. I'm so excited to have a conversation with more Black midwives doing great work. We're going to be talking to folks with for Haitian midwives today at 4 p.m. on our Instagram page. Also, please do visit blkmaternalhealthweek.com. You will learn so much more about all things Black Maternal Health Week, what we have in store throughout the rest of this week of April 11th through 17th. We are so excited. We have so much in store for you. As you heard from all of our wonderful, brilliant, and beloved partners across this nation, across the diaspora, so much is happening throughout this week because guess what? It is about us, you all. This is our time. This is our week to uplift and center our human right for dignity, for well-being, for our health, for our own liberation, to build community, to strengthen our community, right? And to pour back into our community-based organizations. We need to do this work to strengthen the work that we do. Care work is important work, and it is what strengthens our economy. It's what strengthens our communities, our homes, our families. Never forget that. So, on behalf of the Black Mamas Matter Alliance, BMMA, we want to thank every single one of you for showing up, pouring into this space, and rallying with us this afternoon. Attend events. There's probably events happening locally. Attend some of our national events. Again, follow us across our social media accounts. Make sure you use that hashtag BMHW25 and hashtag Black Maternal Health Week. Follow and uplift our incredible Alliance partners who are leading the charge in their communities. Let's carry this energy from today into the rest of the week and beyond, because together we are healing legacies. We are taking collective action and we are building a future rooted in joy, dignity, and liberation for all Black mamas, babies, families, and even all people, you all. We know that our doctors, physicians, our midwives, our doulas provide this necessary, culturally responsive, holistic care work, not just for our communities, but for everybody. Everybody benefits from our care work. So it's that much more important to invest in our work, to support us, and to uplift us. So make sure you're following BMMA on all platforms to stay in the loop. And if you haven't already, check out the full Black Maternal Health Week 2025 schedule of events on our newly launched Black Maternal Health Week website at blkmaternalhealthweek.com. I also want to give a special shout out to our sponsors. Thank you again to California Healthcare Foundation and Merck for Mothers. And I also want to just take a short moment to also specially thank a Black-owned business that has been holding it down and supporting us for a few years, and that is Actively Black. Okay, so shout out to them, and we really do appreciate Actively Black over here. Thank you all again, and so stay tuned. Follow us all on our social media accounts. It's not over. Guess what? Here in Atlanta, it's going to be on and popping tomorrow, Saturday, April 12th. Okay. In downtown Atlanta, we will have the 2025 ATL Black Maternal Health Walk and Block Party. Okay. And it's hosted by us, for Cure for Moms, and of course, with the wonderful City of Atlanta Office of Constituent Services. You don't want to miss it. This is a free event. Definitely go to blkmaternalhealthweek.com to register and sign up and come walk with us, you guys. And we have a ton of activities. Even if you're not able to walk, we just want you to come out and be in community, come engage with a lot of our community-based organizations. We're going to have some Black businesses, some wellness merchants out there as well. So we want everybody to come out. This is how we build community and sustain ourselves and protect, what's valuable for us and by us. So come out for our walk and block party tomorrow. And so, you guys, until next time, happy Black Maternal Health Week. Thank you. We appreciate each and every one of you. And listen, I also need to shout out my wonderful, wonderful staff members. Thank you to Team BMMA. Thank you for all that you do, for everyone that has helped with our campaign, with all the events that y'all are going to see throughout this week. We have a wonderful staff. We have wonderful volunteers, and I thank each and every one of you. Thank you all, and you all have a blessed rest of your week. Happy Black Maternal Health Week, everyone. Thank you, everyone. Happy Black Maternal Health Week. Thank you so much for participating. Thank you, Dr. Jacqueline. Hey, Brittany with Root. What's up? Thank you, Tamika, Mothering Justice. Thank you, Jamara. Who else is still on? Thank you, Mama Toto Village. We appreciate you all. Thank you, Lakeisha. Michaela, thank you so much. Wishing all the best to you all summit and everything that you all are doing. Thank you so much. Thank you. Who else was back here in the back? Stephanie, Asia, Phoebe, thank you so much, Umi. Thank you, Ayana, Milan, everybody that was on. Thank you all so much. Really do appreciate you all. And happy Black Maternal Health Week.
Bye, everybody.
Bye-bye. Happy